Jane? Hi Jane, I'm Louise. I'm going to be your radiographer today. Do you want to come in my room? Come on down with me. Okay. So Jane, I'm going to ask you some questions before we start. So I'm going to explain the exam a little bit to you. I need your full name with your middle initial and your date of birth.
Jane M. McKay, 11/23/70.
Great, thank you. I need to ask you a personal question. Any chance you could be pregnant? Okay. You removed everything underneath your john, including your undergarments. Everywhere. Good. Have you ever had this kind of study before? Okay. So a few questions I need to find out. Did you take a prep kit? Did they have you go buy like an enema or a laxative, and you took it last night? Did it work?
Yeah.
Okay. Have you had anything to eat or drink?
No.
Since midnight last night? I think that's it, right? I mean, as far as what I told you. Did anybody take it? Not so much for the colon. The stomach is really important, but I thought there was one other thing. Okay. So let me explain what we're going to do today. We're going to be looking at your large bowel, and we do this by introducing an enema tip into your rectum, and then we're going to fill your colon with barium. The doctor is going to come in and actually start that and take images and have you move around. Once that part is done, they're going to drain the barium out of your colon, back into the enema bag, and then they'll put in air. You may be a little crampy. Let us know if it's very uncomfortable, okay? There'll be a little bit of a balloon that will be blown up in your rectum, and I just had this urge to laugh. I mean, don't laugh. In your rectum, it's a word. It should hurt, so let us know if it hurts. Okay, so I'll be putting the enema tip in, and then the radiologist will come in and do his part of the exam or her part of the exam, and then after we're done, I will be taking some films where you'll have to hold on to it. So let us know if it's really uncomfortable for you.
Okay.
Okay, any questions? Where's the back door? No? Okay, all right. So, so we're done, and I'm going to have you get up on the table. I'm going to have you lie on your stomach.
I'll do a jump.
You can put both arms up on the pillow or down, whatever's most comfortable for you. How you doing?
Good.
Okay. Well, okay, someone take this over. I'll tell you a story, but I don't want to keep you. Pretty funny. I'll wait till after. Okay, I can't do this. Wait a minute, I found another one. Reminds me if you fold down the end of it like you do with some. Okay, thanks. How you doing?
Still good.
No cramps? Okay, so these are the PAs. So what I'm going to do is make sure I'm at 40, make sure I'm centered to the table, make sure that this is nice and straight, no angle on the tube, even slight. I'm going to center my central ray to my IR, lock it in place. 14, 17 lengthwise. Oh, I'm not doing the PA for you. Right. Well, I'll just show you. You have to like poke it a little bit, okay?
So we don't have to put them in Sims position.
No, you do. Thank you. I knew there was another thing I was supposed to do. I'll show it to you at the end. Just a little bit more, Jane, over. Okay, good. So this is the PA or AP, center top of the crest. I'm already centered here. Keep my central ray. Oops. Is that better? Better. Sorry, am I poking too hard? Okay. All right, take in a nice deep breath. Blow it out. Hold it out. Don't breathe. And click. You can can breathe. Now, you don't have to do this for lab, but I just thought I'd show you. So I'm gonna do 35 degrees. I'm gonna bring it down and back. So what I wanna do is center the IR in my central ray first. Okay, once I've done that, I'm gonna double check my SID. 39 and a half. I'm going to leave it at that. I'm not going to futz with it. Oh!
Oh,
My God. Ghosts.
everybody say hi, Chrissy.
Okay.
BE ghost.
The BE ghost, yeah. I'm going to come down just a little bit in my collimation. You don't have to, but just to tighten it up a little bit. I'm centered. So remember I said you start with kind of coming in the small of the back, almost the top of the crests. You should be exiting. I'm going to poke you, okay? Got it. ASIS is right about here, right? Good. Okay. Got my left marker on. I should change my film. Notice how low the tube seems, but we have put an angle on this, okay? So to get 40, you are going to be low to the patient. That looks good. Taking a deep breath, blow it out, hold it out, don't breathe, and click. Only one breath for abdomen, so remember that, not two like for the chest. So when you do this, if you do this like I just did it, it can be fast and pretty simple. Angle, bring it up, center to your IR, check your SID. If you bring it about 34 on the measurement on the column, at a 35-degree angle, you should be about 40 to your film, okay? The problem is that when you start this, and then if you move this, instead of your patient and you forgot, then you're going to have to start all over. Okay? Any questions on that one? That's the PA angle. I'm going to come back up. I'm going to recenter this. Okay? I'm going to have to put your right arm by your side and your left arm up on the pillow. I'm going to move this a little bit. I want you to roll up on your right hip, bending your left knee. Good. You should be starting to be able to minimize the steps that you take to position a patient. Not having to repeat. I'm just going to move you a little bit. Okay, good. If you follow those, how I just did that, hopefully you saw how kind of smooth it went, and I'm not going back and forth with my patient. So my film is centered to my IR. My patient is in the right position, about 45 degrees. I'm going to go top of the crest. I'm centered. I want to make sure that her body is completely in the middle and that both sides are going to be included equally. This gets a little tricky with the oblique, okay? To visualize it. It's easy with the AP or PA because they're pretty symmetrical and nothing, one is up, one is down. So you should get comfortable with checking to make sure the entire abdomen is in. If the radiologist or the patient body habitus, you might come up a little bit for the flexors. So which flexor am I going to see best in this RA view?
No, the right. It's the right.
It's the right. It's the side down on the AOs. So it's the hepatic flexor on this one. Okay? Okay, so Jana,
Is your marker the right side or the left side?
it's on the left side.
Okay.
So it doesn't matter that it's a right, Scooby-Doo. As long as I have the correct marker on the correct side of the patient. You don't need to mark this the right, I can mark this left. Okay? All right. Anything else about this? So that was a PA angle. and the RAO, and we're gonna do a right lateral rectum. So I'll have you roll up on your right side, Jane. Put your knees together, your legs together rather, both legs, and arms up by the pillow. So before you do anything, you should always position your patient, especially if they're, compliant and will stay in a position for you. Shouldn't have to repeat that too much. If you initially get them in the correct position and a good lateral, you shouldn't have to repeat much of anything. Change my IR. I'm going to go down to an 11 by 14. Come behind in a second. So I'm going to palpate your ASIS. It's where my thumb is. Can you guys see? Just want you to be able to get this. My thumb is where her ASIS is, right, Jane?
Mhm.
That feels like it. Make sure she's nice and loud. This is a right lateral. I'm just going to come behind here. I want to make sure that my lead is up against the shadow of her. And I'm going to push her forward a little bit, or pull her forward a little bit more. I need a little bit more light field there. You see it? How's that look? Yeah. Okay. A little bit of light field on the table so you can put your marker, and also know that, remember that the sacrum is here. The rectum area follows the curve of the sacrum. So it's anterior to the sacrum, but it's pretty close to the back of the butt. Okay? That's the right lateral. So that's going to be one choice. PA angle, RAO or LAO, and a right lateral. Okay? PA angle, LAO, RAO, right lateral. Rectum. Can you roll over on your left side? I want to show the Sims position. Thanks for your hours. Oh, reminding me. I have a bit of a migraine today, so I'm not. Yeah, it's just small. Okay, so she did it. She's anxious to be hooked, I think. So you want the patient on the left side, rolled slightly forward. Gives the best access, sort of. You okay?
Mhm.
Okay. Right leg up and over, and that's the Sims that you want for.
So that's where we're gonna start.
You're just gonna let the